हेलो एवरीवन, वेलकम बैक टू आवर चैनल नर्स अड्डा। जैसे कि आप लोग जानते हो कि हमारे चैनल में नर्सिंग कॉम्पिटिटिव एग्ज़ाम से रिलेटेड सारे ही पेपर को सोल्व किया जाता है और इम्पोर्टेंट टॉपिक्स डिस्कस किया जाता है। अभी क्योंकि नॉर्सेट का डेट आ चुका है तो हम कंटिन्यूसली सैम्पल पेपर लेकर आ रहे हैं नॉर्सेट का ही डेली। तो ये हमारा हो चुका है 10th पेपर। अगर आपने प्रीवियस एग्ज़ाम पेपर नहीं देखा है तो जाकर देख लीजिए, उसका एक अलग से प्लेलिस्ट बना हुआ है। ओके, तो बिना टाइम गवाए आज का एग्ज़ाम स्टार्ट करते हैं। ओके, आज का होने वाला है सेट 10। टोटल क्वेश्चंस होंगे रियल एग्ज़ाम पैटर्न लाइक 100 क्वेश्चंस। टाइम लिमिट होगा आपके पास 90 मिनट्स। Maximum marks is 100. Instructions are each question carries 1 mark and select the most appropriate answer. Attempt all questions. And in real exam pattern, negative mark is also there. That is 1/3 mark. Okay. टोटल 100 क्वेश्चंस में 80 क्वेश्चंस नर्सिंग के रिलेटेड आते हैं और बाकी के 20 जीके, इंग्लिश, कंप्यूटर, मैथमेटिक्स, अर्थमेटिक और रीजनिंग ये सब इंक्लूड होते हैं। ओके, लेट्स मूव इनटू द फर्स्ट क्वेश्चन। A nurse accidentally touches the sterile tip of a urinary catheter while inserting it. What is the best action? Your correct answer is option C. Replace the catheter with a new sterile one. Explanation is, once the sterility is broken, the catheter is considered contaminated and must be replaced to prevent catheter-associated urinary tract infection, that is COTI. Okay. हम सारे क्वेश्चन के साथ रैशनली या एक्सप्लेनेशन नहीं देंगे, जहाँ पे नीडेड होगा बस वहीं पर ही देंगे। ओके, सेकेंड क्वेश्चन। ए पेशेंट विथ हेड इंजुरी सडनली डेवलप्स अनइक्वल pupil. This finding most likely indicate what? Your correct answer is option B. Increased intracranial pressure. Explanation is, unequal pupil is also known as anisocoria. In head injury may indicate rising intracranial pressure and possible brain herniation is also there. Okay. Next question. Which ABG finding indicate metabolic acidosis? Your correct answer is option B. pH 7.30 and bicarbonate 18 milliequivalent per liter. Your explanation is, normal values of these are pH is 7.35 to 7.45, bicarbonate is 22 to 26 milliequivalent per liter, and PaCO2 is 35 to 45 mmHg. These are the normal values. For solving electrolyte imbalance question, we have to know these normal values. Okay, so by heart it. Here pH is given as 7.30, so low acidosis, and bicarbonate is 18, that is low bicarbonate level. So since bicarbonate is abnormal, the problem is metabolic only. Okay, so the diagnosis is metabolic acidosis. Rome is a trick to remember. R in Rome, R is respiratory and O is opposite, M is metabolic and E is equal. Okay, if shortcut is pH and bicarbonate move in the same direction, then it is metabolic, and if it is pH and carbon dioxide move in opposite direction, then it is respiratory. Okay, तो ये जितने भी हम क्वेश्चन सॉल्व कर रहे हैं आप ये या तो नोटबुक में नोट डाउन कर लो या तो ये वीडियोस को सेव कर लो। एक दो बार रिवाइज करोगे आपको याद हो जाएगा। ठीक है, ये सारे एग्ज़ाम में इस टाइप के क्वेश्चंस रिपीट होते हैं। A patient on prolonged bed rest suddenly develops sharp chest pain and severe shortness of breath. Which condition should the nurse suspect first? Your correct answer is option B, pulmonary embolism. Explanation is sudden dyspnea, chest pain after immobilization are the classical features of pulmonary embolism. Okay. Next one, a nurse notices swelling and coolness around the IV cannula while potassium chloride is infusing. What should be done first? Your correct answer is option B, remove the IV cannula. Okay. Explanation is swelling and coolness indicate IV infiltration. Stop the infusion and remove the cannula. Question number 6. A post-op patient suddenly becomes restless, tachypneic, and his SpO2 drops from 98% to 89%. What is the nurse's first priority? Your correct answer is option B, administer oxygen and assess the airway. Explanation is airway and oxygenation are the first priorities according to ABC approach. Question number 7. A patient with dengue has a platelet count of 18,000 per millimeter cube. Which nursing intervention is most appropriate? Your correct answer is option C. Avoid unnecessary needle pricks and monitor for bleeding. Explanation is severe thrombocytopenia increases the risk of spontaneous bleeding. Next question. Before giving insulin, the glucometer reading is 48 mg per deciliter, but the patient is conscious and able to swallow. What is the nurse's best action? Your correct answer is option B. Give a fast acting oral carbohydrate immediately. Explanation is conscious patients with hypoglycemia should receive 15 to 20 gram of fast acting carbohydrates. Next question. A 6-month-old infant is admitted with severe dehydration due to diarrhea. Which IV fluid should be started first? Your correct answer is option B, Ringer lactate. Explanation: Ringer lactate is the preferred initial IV fluid for severe dehydration in children as per standard pediatric dehydration management. Next question. A nurse enters a patient's room and finds the patient on the floor after a fall. What is the first nursing action? Your correct answer is option B. Check the patient's level of consciousness, airway, breathing, and circulation. Explanation is after a fall, the nurse should first assess the patient's condition using the ABC approach before moving the patient or completing the documentation. Okay? Next one. A 2-year-old child suddenly develops a barking cough and inspiratory stridor. Which condition should the nurse suspect first? Your correct answer is option B, croup. Explanation is barking cough with stridor is the classic presentation of croup. Next question. A nurse is caring for a patient with a chest tube. Continuous bubbling is seen in the water sealed chamber. What does it indicate? Your correct answer is option B, air leak. Next question. A patient with DKA or diabetic ketoacidosis has a blood glucose level of 480 mg per deciliter. Which treatment should be started first? Your correct answer is option B, IV normal saline. Explanation is fluid replacement is the first priority in DKA. A patient suddenly develops facial deviation and weakness of the right arm. What is the nurse's priority action? Your correct answer is option B, activate the stroke protocol. Explanation is sudden neurological deficit require immediate stroke management. Next one, a newborn is diagnosed with a cleft lip. Which nursing intervention is the most appropriate during feeding? Your correct answer is option A, feed the baby in a semi-upright position. Explanation is a semi-upright position reduces the risk of aspiration and facilitate feeding in infant with a cleft lip. Okay, basically it reduces the risk of aspiration. Next question, a patient with epilepsy is actively convulsing. What should the nurse do first? Your correct answer is option C, protect the patient from injury. Explanation is prevent injury during a seizure. Do not restrain or force object into the mouth. Next question. While selecting a TT tube or tracheostomy tube for a child, the appropriate tube size is primarily determined by your correct answer is option B, child's age and body size. Next question. A child is brought to the emergency department after accidentally swallowing kerosene. What should the nurse advise the parents first? Your correct answer is option C. Do not induce vomiting and seek immediate medical care. Explanation is inducing vomiting after kerosene ingestion increases the risk of aspiration pneumonitis. Prompt medical evaluation is required. Question number 19. A patient with suspected meningitis should be placed under. Your correct answer is option C, droplet precautions. What is the standard temperature and pressure used for sterilization in a autoclave? Your correct answer is option A, 121 degrees Celsius at 15 psi for 15 to 20 minutes. Next question. A nurse checks gastric residual volume before a tube feeding and find a large residual. What should the nurse do first? Your correct answer is option B, stop feeding temporarily and reassess as per protocol. Explanation, a high gastric residual may indicate delayed gastric emptying and increases aspiration risk. Okay. Next one, which patient has the highest priority in the emergency department? Your correct answer is option B, chest pain with sweating and hypotension. Explanation, these findings suggest a possible acute MI with shock. Next one, a patient receiving warfarin has an INR of 6.5 without bleeding. Which antidote may be prescribed for this patient? Your correct answer is option A, vitamin K. Next one, a newborn weighing 3 kg requires adrenaline during neonatal resuscitation. What is the recommended IV dose of adrenaline in the ratio of 1:10,000? Your correct answer is option B, zero point 0.3 to zero point 0.9 ml. Explanation is the recommended IV dose is 0.01 to 0.03 mg per kg, but in options they are mentioned in ml per kg, so we have to convert it into ml per kg, that is 0.1 to 0.3 ml per kg of 1 is to 10,000 ratio. For a 3 kg newborn, this is 0.3 to 0.9 ml. Okay, understood now? Next question. A child is admitted with suspected intussusception. Which classic symptom is most characteristic? Your correct answer is option B, red currant jelly stool. Explanation. Red currant jelly stool, blood mixed with mucus, are a classic find in intussusception. Next question. A nurse notices that an IV infusion pump is alarming due to occlusion. What should be checked first? Your correct answer is option B, IV tubing for kinks or blockage. Next one. A newborn has caput succedaneum after a normal vaginal delivery. Which statement about this condition is correct? Your correct answer is option C. It crosses the suture line and resolves spontaneously. Explanation is caput succedaneum is scalp edema present at the time of birth. It crosses the suture lines and usually disappears within a few days without any treatment. Next one. A patient with burns has synced nasal hair and hoarseness. What should the nurse suspect first? Your correct answer is option B, airway inhalation injury. Rationale is synced nasal hair and hoarseness of voice are the warning signs of inhalation injury. Next one, which insulin can be administered intravenously in an emergency department? Your correct answer is option D, regular insulin. Next one, a patient suddenly becomes confused after receiving oxygen therapy. Which assessment should the nurse perform first? Your correct answer is option A, check oxygen delivery device and SpO2. Explanation is confusion may indicate hypoxia or oxygen therapy issues. Assess oxygen first. Next one, which vitamin deficiency is most commonly associated with betot spots? Your correct answer is option C, vitamin A. Coplic spots are a characteristic feature of which disease? Your correct answer is option C, measles. Next one, which electrolyte imbalance causes U waves on ECG? Your correct answer is option B, hypokalemia. Next one, the first heard sound S1 is produced by the closure of which valves? Your correct answer is option B, mitral and tricuspid valves. Which cranial nerve is responsible for corneal reflex in sensory limb? Your correct answer is option A, trigeminal nerve or cranial nerve 5. Explanation is cranial nerve 5 carries the sensory input while cranial nerve 7 produces the blinking effect. Okay? Don't be confused with these options. 5 carries the sensory input and 7 produces the blinking effect. Next one, the antidote for methotrexate toxicity is. Your correct answer is option C, leucovorin or folinic acid. Next one, which condition is known as the blue baby syndrome? Your correct answer is option A, tetralogy of Fallot. Next one, Erb's palsy most commonly occurs due to the injury to which nerve root? Your correct answer is option A, C5 to C6. Explanation is Erb's palsy result from upper brachial plexus injury or C5-C6 injury. Okay. Next one, which hormone is called the emergency hormone? Your correct answer is option C, adrenaline. Explanation is adrenaline prepares the body for the fight or flight response. Next one, which fetal heart rate pattern is considered reassuring or normal during labor? Your correct answer is option C. Baseline fetal heart rate is 110 to 160 beats per minute. Okay. Next one, a fever that remains continuously above the normal level with a fluctuation of less than 1 degree Celsius in 24 hours is called what type of fever? There are so many types of fever. Okay. Your correct answer is option C, continuous fever. Next one, fever that returns to normal between episodes is known as which type of fever? Your correct answer is option B, intermittent fever. Vaccines under the Universal Immunization Program should generally be stored at in which range of temperature? Your correct answer is option C, 2 degrees Celsius to 8 degrees Celsius. Most of the vaccines are stored in this range only. Okay. Next one, which vaccine is most sensitive to freezing? Your correct answer is option B, pentavalent vaccine. Which program aims to eliminate tuberculosis in India? Your correct answer is option B, NTEP. नेशनल ट्यूबरक्लोसिस प्रोग्राम है ठीक है. नेक्स्ट क्वेश्चन, विच नेशनल प्रोग्राम फोकसेस ऑन स्क्रीनिंग चिल्ड्रन फॉर बर्थ डिफेक्ट डिसीज डेफिशिएंसी एंड डेवलपमेंटल डिले? योर करेक्ट आंसर इज ऑप्शन बी, RBSK. एक्सप्लेनेशन इज राष्ट्रीय बाल स्वास्थ्य कार्यक्रम RBSK provides early identification and intervention for the children. Okay, moving to the next question. Question number 47. Which condition is characterized by sudden onset, fluctuating consciousness, and poor attention? Your correct answer is option B, delirium. Next one, which feature is more characteristic of dementia than delirium? Your correct answer is option C, progressive memory loss with clear consciousness in early stages. Explanation is dementia is usually chronic and progressive in nature with memory impairment is there. Okay. Memory impairment is there, but dementia is chronic and progressive in nature. Next question. Which vaccine is administered at birth by the intradermal route? Your correct answer is option B, BCG vaccine. Next one. Which mental health disorder is characterized by hallucinations, delusions, and disorganized thinking? Your correct answer is option B, schizophrenia. Next one. Which ECG change is most characteristic of acute myocardial infarction or STEMI? Your correct answer is option B, ST segment elevation. Next one. The first permanent tooth to erupt in a child is? Your correct answer is option C, first molar in 6-year-old. Okay, first molar. Next one. Which primary tooth erupts first in infant? Your correct answer is option C, mandibular central incisor. Next one. Which instrument is commonly used to remove foreign bodies from the nose? Your correct answer is option B, teleforceps. Next one. According to the rule of nines, the anterior trunk in an adult account for? Your correct answer is option B, 18%. Next one. During Leopold first maneuver, the nurse assesses what? Your correct answer is option B, fundal grip to identify the fetal part in the uterine fundus. Next one. At what age does a child typically walk without support? Your correct answer is option C, 12 months. Next one. How many primary, deciduous or milk teeth are present in a healthy child? Your correct answer is option B, 20. Explanation is a complete set of primary or milk teeth consists of 20 teeth, 10 in the upper jaw and 10 in the lower jaw. So here milk teeth is total 20 in number and permanent teeth or deciduous teeth is 32 in number. Next one. Which sterilization method is most suitable for glass syringes and metal surgical instrument? Your correct answer is option C, autoclaving. Next one. Multiple sclerosis primarily affect which part of the nervous system? Your correct answer is option C, myelin sheath of the central nervous system. Explanation is multiple sclerosis is an autoimmune demyelinating disease that damages the myelin sheath of the brain and spinal cord. So here your trick is MS means multiple sclerosis, myelin sheath means MS only. Okay, so ऐसे हम याद कर सकते हैं MS और myelin sheath प्लस CNS. समझ गए ना? मल्टीपल स्क्लेरोसिस में माइलिन शीथ प्लस सीएनएस इन्वॉल्व होता है और दोनों में एमएस है. ओके, समझ गए? नेक्स्ट वन. विच विटामिन डेफिशिएंसी कॉजेस पेलेग्रा? योर करेक्ट आंसर इज ऑप्शन सी, विटामिन B3 niacin. Explanation is pellagra is characterized by 3 Ds. ओके, तो 3 Ds भी है पेलाग्रा में और डेफिशिएंसी भी ऑफ विटामिन B3 भी है, तो दोनों में 3 है. ओके, सो इन दीज 3 Ds डर्मेटाइटिस, डायरिया एंड डिमेंशिया आर इंक्लूडेड. नेक्स्ट वन. Which electrolyte is the major intracellular cation? Your correct answer is option B, potassium. Rationally, potassium is the main intracellular cation while sodium is the major extracellular cation. इंट्रासेलुलर में पोटेशियम है और एक्स्ट्रासेलुलर में सोडियम है. नेक्स्ट, विच विटामिन deficiency causes megaloblastic anemia? Your correct answer is option B, vitamin B12 deficiency. Next, which disease is caused by varicella zoster virus? Your correct answer is option B, chickenpox. Next, which investigation is considered the gold standard for diagnosing pulmonary tuberculosis? Your correct answer is option C, CBNAT. Next, which insulin is classified as long-acting? Your correct answer is option C, glargine. Which primitive reflex disappears first in a normal infant? Your correct answer is option C, stepping reflex. Next one, the Moro reflex normally disappears by the age of. Your correct answer is option B, 4 to 6 months. Next one, which nerve is commonly injured after an intramuscular injection in the gluteal region if the wrong site is used? Your correct answer is option B, sciatic nerve. Next one, which disease is commonly associated with the butterfly or Muller rash? Your correct answer is option B, SLE or systemic lupus erythematosus. Next one, which newborn reflex is elicited by stroking the baby's cheek? Your correct answer is option B, rooting reflex. Explanation is, stroking the cheek causes the infant to turn the head towards the stimulus and open the mouth. Next one, which newborn assessment is used to determine the gestational age of a newborn? Your correct answer is option B, Ballard score. Next explanation is, Ballard score assesses physical and neuromuscular maturity to estimate the gestational age of a newborn. Next one, which disease is caused by deficiency of surfactant in premature babies? Your correct answer is option B, RDS or neonatal respiratory distress syndrome. Explanation is, surfactant deficiency causes alveolar collapse and respiratory distress in preterm infant. Okay. Next one, which electrolyte is mainly responsible for nerve impulse transmission? Your correct answer is option B, sodium. Next one, which condition is most commonly associated with a positive otolini test in a newborn? Your correct answer is option B, DDH, developmental dysplasia of the hip. Next one, which microorganism causes whooping cough? Your correct answer is option B, Bordetella pertussis. Next one, which electrolyte imbalance is commonly seen after severe diarrhea? Your correct answer is option C, hypokalemia. Next one, which National Health Mission or NHM component mainly focuses on maternal and child health? Your correct answer is option B, RMNCH plus A. Explanation is, RMNCH plus A covers reproductive, maternal, newborn, child and adolescent health. Next one, which psychiatric disorder is characterized by recurrent intrusive thought and repetitive compulsive behavior? Your correct answer is option C, OCD, obsessive compulsive disorder. Next one, which disease is caused by deficiency of vitamin D in children? Your correct answer is option B, rickets. नेक्स्ट वन, सो 81 से 100 तक हमारा मैथ्स, जीके, कंप्यूटर ये सब इंक्लूड होगा, यानी नॉन नर्सिंग पार्ट. 81, द रेशियो ऑफ men to women in a hospital is 5:3. If there are 120 men, how many women are there? Your correct answer is option B, 72. Explanation, 120 into 3 divided by 5, that is 72. ठीक है. Next question, a work can be completed by A alone in 12 days. How many days will A take to complete 50% of the work? बिना पेन पेपर से ये कैलकुलेट हो जाएगा. Very easy but tricky one. Your correct answer is option C, 6 days. Explanation, half of 12 days is 6 days. हाफ वर्क बोला है तो हाफ डेज लगेगा. नेक्स्ट वन, कन्वर्ट 104 डिग्री फ़ारेनहीट इंटू डिग्री सेंटीग्रेड. योर करेक्ट आंसर इज ऑप्शन बी, 40 डिग्री सेल्सियस. Explanation is 104 minus 32 into 5/9. By this we get the right answer. Next question, if 5 nurses complete a task in 8 days, how many days will 10 nurses take to complete the same task? Your correct answer is option B, 4 days. Explanation, men into days is a constant, तो हम फॉर्मूला बना सकते हैं M1D1 इज इक्वल टू M2D2. ठीक है, इससे तुम्हारा आंसर मिल जाएगा. नेक्स्ट वन, फाइंड द मिसिंग नंबर. योर करेक्ट आंसर इज ऑप्शन सी, 48. नेक्स्ट, चूज द करेक्टली स्पेल्ड वर्ड. योर करेक्ट आंसर इज ऑप्शन सी, ऑप्शन बी, occasion. Next one, choose the correctly spelled word. Your correct answer is option B, embarrassment. Next one, if south is become north, then north is become what? Correct answer is option B, west. A clock shows 3 p.m. What is the angle between the hour hand and the minute hand? Your correct answer is option C, 90 degree. Next one, in a row of 40 students, Rahul is 12th from the left. What is the Rahul position from the right? Your correct answer is option C, 29th position. Explanation is position from right is equal to total student minus position from left plus 1. 40 minus 12 plus 1 is equal to 29. So here trick is right position means total minus left plus 1. ठीक है. नेक्स्ट वन, चूज द करेक्टली स्पेल्ड वर्ड. योर करेक्ट आंसर इज ऑप्शन ए, मेंटेनेंस. नेक्स्ट वन, fill in the blank. The patient dash admitted yesterday. Your correct answer is option B, was. Explanation is yesterday indicate the simple past tense, so here we will use was. Next, choose the synonym of fragile. Your correct answer is option B, delicate. Next, if A is equal to 1, B is equal to 2, C equal to 3, then what is the value of care? Your correct answer is option B, 27. Explanation, C means 3, A means 1, R means 18, E means 5, then 27. Okay. Next, which number comes next? Your correct answer is option C, 36. These are all the square. All are the square of next one. Explanation, these are perfect square, 1 square, 2 square, 3 square, etc. Okay. Next one, the headquarters of the International Committee of the Red Cross ICRC is located in which place? Your correct answer is option B, Geneva or Switzerland. Next one, the founder of the Red Cross movement is? Your correct answer is option B, Henry Dunant. Next one, what is the full form of NABH? Your correct answer is option A, National Accreditation Board for Hospital and Healthcare Provider. Next one, what is the full form of ICU? Your correct answer is option A, Intensive Care Unit. Next one, which country is known as the land of the rising sun? Your correct answer is option C, जापान. तो इसी के साथ हमारा 100 क्वेश्चन कंप्लीट होता है. लास्ट में थोड़ा फास्ट मुझे रीड करना पड़ा, ठीक है. अगर आपको वीडियो थोड़ा सा भी हेल्पफुल लगा तो वीडियो को लाइक करें, सब्सक्राइब करें और कमेंट करें, ठीक है. प्लीज़ सब्सक्राइब आवर चैनल, फॉलो फॉर मोर वीडियोज़. थैंक यू फॉर वॉचिंग द होल वीडियो. थैंक यू फॉर वॉचिंग द होल वीडियो के साथ.